My name's Matthew Snuffer. I'm a paramedic. Also work as a EMS instructor for New River. Just a few years ago, when I first became certified, there was not a great push or need for early recognition of sepsis or treatment of sepsis and septic shock in the field. We did uh, have protocols for treating heart attacks and strokes, and but our treatments for sepsis were more supportive in nature. Um, One night, we got called out to the home of a 58-year-old male who was having flu-like symptoms for about 3 days. And when we got there, he was very weak, disoriented. He was having a low blood pressure. His heart rate was elevated. His glucose was elevated. He was even having difficulty breathing. Um, on the way, we did a few more diagnostic tests to rule out heart attacks and strokes and things of that nature, and gave him some medications on the way to help with his blood pressure. Later, we found out that he was actually in severe septic shock. Um, his labs showed that his lactic acid was very elevated to about 4.8. And for whatever reason, that case has always stuck with me. Uh, in doing some research about sepsis and septic shock, I also found that time and early recognition and treatment really saves lives. Um, the CDC defines sepsis as a clinical syndrome caused by a dysregulated host response to infection. It also states that sepsis begins outside the hospital for nearly 80% of its patients. A study published in Oxford Academic uh, associated mortality rates between 2009 and 2014 and estimated that the adult prevalence of greater than 1.7 million cases had contributed to 265,000 deaths, and thus confirming the immense public health impact of sepsis. In a Jim's article, they talked about two different criteria for helping paramedics and EMTs diagnose sepsis in the field. One of them was the Robinson screening tool, which dealt with probable or confirmed infection, change in mental status, a temperature over 100, heart rate over 90, respirations over 20, and glucose over 120. The SIRS, or System Inflammatory Response Syndrome, that criteria also looks at heart rate, temperature, respiratory rate, as well as white blood count and lactic acid levels. And even though a lot of our services around here do not have the money or the technologies to obtain these white blood counts and lactic acid pre-hospital. However, there is some things that we can do. Uh, EMTs and paramedics, we use capnography all the time. It gives us valuable insights to someone's ventilation, how well they're breathing, and how well they're perfusing, how well their tissues are being oxygenated. But a study out of a Jim's article in October of 2015 also shows that there is a correlation between the end-tidal CO2 given by the capnography and someone's lactic acid levels. They they state in that article that end-tidal readings less than 25 in a clinical setting may be associated with lactic acid levels of 6.1 or greater. Um, there was another study in the Journal of Thoracic Disease that allows the diagnosis of sepsis if persistent hypertension after fluid resuscitation and requiring vasopressors to maintain mean arterial pressure greater than 65, and a serum lactic level greater than 2, it requires that those two conditions be present before the diagnosis can be given. Out of all these studies that I've read, the best course of treatment for these patients, they seem to all agree that they need fluid resuscitation, vasopressors, IV antibiotics, possible airway support and management, blood counts, metabolic enzymes monitored very closely from pre-hospital to discharge. In conclusion, given the studies that are being conducted and even some of the pilot programs that are going on elsewhere about the country, I believe that it will not be long before we start seeing a sepsis protocol or a sepsis alert in our pre-hospital settings in this region. If you recall, the patient that I had earlier ended up being very sick. His heart rate was elevated, blood pressure was very low. Even though I may not have recognized it at the time, he was in fact in severe septic shock. These signs and symptoms are never to be taken lightly, and almost always make for a very sick patient. I hope that I have given you some information today that will aid in early recognition and guide your treatment plans in the future when dealing with sepsis and septic shock. Thank you.